Good morning and welcome back to Morning Express. Thank you so much for staying with us and exhilarating the conversation that Michael had with our person of interest this morning. And as he mentioned, we want to shift gears now. In Your Health segment today, we focus on matters of abortion. So the headline yesterday on the Standard newspaper, Factories of Death. In case you missed it, this is how it looked like, and had statistics on some of what are worrying and staggering figures that we saw there. 500,000 women procuring abortions every year, and of this, over 300,000 are from backstreet clinics. And it was detailed and extensive coverage. Just to quickly look at it, you had the backstreet clinics where 3,000 women die every year. So 3,000 women are dying, and this is more than the number that are killed by cervical cancer, which is a huge issue amongst women in healthcare. And then you also have the quacks that end 375,000, as I told you, so those backstreet clinics that are helping this to happen and seeing that that happens. Doctors reveal why women are terminating pregnancies was part of the details that came out from that, but also the interns that are being accused of abetting their abortions, and also doctors at public hospitals left to carry the ball, and some of the drugs that are being mixed. You have cancer drugs and other drugs being mixed up to ensure one can abort. It's quite a grim picture that was painted by the Standard newspaper yesterday, and that coverage continues on today. And I'm seeing the Nation carrying on with that agenda. One of the stories it has today is mothers put their teens on birth control. So it's a huge subject with various angles to it, and that's what we want to explore this morning with my guest in studio. And joining me to my extreme left is Dr. Chima Izugbara. He is a senior research scientist at APHRC Nairobi. What is APHRC, sir?
APHRC stands for the African Population and Health Research Center.
Okay. Yeah. Thank you for joining us. And also Dr. Wycliffe Musalia. He's a consultant gynecologist at the Kenyatta National Hospital, also a lecturer at the University of Nairobi. Gentlemen, we thank you for being with us this morning. I'll start with you, Dr. Izugbara, on this particular study that was conducted and some of the statistics. Does it shock you what you saw yesterday?
Well, there are two sides to it. It can be shocking because most of these things are preventable. But it's also not shocking because our systems are broken. The health system is broken, the family planning system is broken, and this is also similar to what you find in the region. So depending on how you look at it, it can be shocking. And also,
what goes into this kind of research? You're a research scientist. In terms of being able to get this kind of figures in a country over 40 million and counting?
Well, a lot goes into it. I think in that particular study we spent almost $500,000 to be able to do this kind of study. And the methodology we used in that study was about the most robust globally, in terms of looking at the incidence of induced abortion in any country.
Okay. So break this down for us, Dr. Ari, because the people hear abortion and the first thing they're thinking, these are just some murderers out there doing some terrible things. Break it down for us in as far as when abortion is okay, what our laws say about abortion, and when it is not okay.
Okay, I think our constitution has looked at the issue of abortion as being spontaneous, where it occurs naturally, or it may be induced for medical reasons. So what the constitution says that is every woman of reproductive age has a right to emergency care, and also when the mother's life is in danger, then there is room for terminating the pregnancy. So those are the two instances that we look at. When we look at the issue of the mother's, the mother's life being in danger, then basically a woman might conceive and she would like to carry on with the pregnancy, but we find she has an underlying medical condition which may have been pre-existing or has come about because of the pregnancy, which puts her life at risk. So in that particular case, we may elect to terminate the pregnancy. But there are also situations where a woman has conceived and the pregnancy undergoes a spontaneous miscarriage, and she presents to a facility bleeding. So that puts in the emergency situation where a health provider feels that to arrest the bleeding, which puts the woman at risk, they will complete the process of abortion. Yeah.
All right, so that is what is constitutionally allowed.
Yes,
in
yeah,
those
yeah.
situations, it's
Yes,
okay.
yeah.
When is it not okay? So this is when a person goes and...
Okay, we have situations where maybe a woman has had unprotected sex, she didn't use a contraception, and she has conceived, and she's not keen to carry on with the pregnancy for various reasons, mostly social reasons. Then
When you say social, you mean, break it down for us.
okay, it depends. Looking at, say, a young teenage girl who is probably in school, may want to continue with the school. Or probably she feels ashamed of what she has done, and she's not able to face her parents. So she feels probably it would be wise to go somewhere quietly and terminate the pregnancy, and life continues quietly. Or if you look at a woman who is maybe young woman in her 20s, she's single, and she has conceived, and they are not ready to continue with the pregnancy together with the partner, or maybe the partner has taken off, so she decides to terminate the pregnancy. Sometimes we even find married people who have had 3, 4 children, and they were not on any protection, and the woman conceives. Then she feels like, I think I've had enough, I'm not ready for another one. So those are situations where these women may approach a service provider in need of abortion.
And in those particular cases, it is illegal when these service providers go ahead. Isn't that correct?
Yeah, as far as our laws are concerned for now, these women need to be taken through counseling because the law does not allow for us to terminate the pregnancy unless there's a medical complicating condition.
Okay.
Yes.
Talk to us about what you found for those who did not manage to read the stories in the Standard, breaking down what the picture looks like. Grim, in fact, but break it down for us.
Yeah, let me also, in addition to what Doctor has said, just add as well that there are also women who get raped. You know, it's not just a question of having unprotected sex. There is incest happening on a daily basis. Women are getting sexually abused on a daily basis, and sometimes these things result in unintended pregnancies as well. So, while there might be people who willingly, you know, have sex, there is also that large number of people who are having, who are in those situations of rape and all that. And I think those situations also need to be put into consideration while this issue is at stake. So the study we did, like I said, was a nationally representative study which covered all of Kenya, all the regions, and virtually all the counties as we speak. And the key things that came out, like you said, include that there were about 500,000 abortions that happened in 2012, which when we did this, when the study was done, and that 70% of the women who had those abortions were not on any contraceptive. Yes. That's also a major finding. About 59% of the women were in rural places. Roughly 67% of them were married. About 42% of them we are below 24, we are below 25, and all that. And there were Muslims and Christians and all kinds of people in the statistics. So it's not a schoolgirl problem, you know, like we used to.
Across the board.
It's like we used to think in the past. It involves virtually every several women in the country, and we found women, young girls, as young as 11 years.
Yeah,
you know.
because between 10 and 19 years was 45%, according to a study that are conducting these abortions.
Yeah.
So in that, or having them, procuring them. So for you, talking to these young people at that particular age, 10 to 19, it is just what is it that gets them to that place?
So like he says, several things get them to that place.
The social issues.
Yeah, there are social issues. People need to continue with the education. I mean, there is so much stigma associated with teenage pregnancy. People are in school and they want to get back. Parents don't want to hear that their daughters are getting out of school because of pregnancy. There is, of course, lots of unprotected sex going around.
What about the married ones? Because that for some would be shocking, that somebody is married and would choose to?
Well, you know, sometimes in marriage too, not many people use family planning services. We know that men are also in several places in stronger position, you know, against their women using family planning services. And there is also so much myths. We have several myths and misconceptions around family planning in the country and in many other places. And some of these things, I think, might have implications on the willingness of women to use family planning services. And sometimes contraceptives are not foolproof. Sometimes they fail, and, you know, and result in unintended pregnancies.
Yeah. When you saw this, Dr. what did you make of this finding of this particular study?
The study, I think what it looked at was, for the first time, we wanted to document the numbers. What figures are we looking at? Because we talk about abortion, but we've never had a chance to really know what is the magnitude of the problem. So looking at it, yeah, true, the problem is there is real. And I think looking at the grim pictures that you have painted through the print, it calls us to action. And so we need to have a discussion on this, because 462 terminations going on all over the country is something that shows that something is wrong and something needs to be done.
Yeah.
Yes.
So what is that needs to be done? Let's get to that, because one of the reports today, again in the Standard, talking about that the government needs to have more of this awareness being spread to these younger people in terms of protective sex or sex education. As from where you sit, what needs to happen?
Yeah, that is true. There are several interventions that we need. Basically, targeting those who are procuring these abortions, because we realize they face a certain social problem. So these are the social issues that need to be looked at. One, at the family level, there needs to be support, okay, for all young girls, so that there's open discussion. Whenever a young woman conceives, okay, many of them are embarrassed to talk about it. So as parents, as brothers or sisters, we have to be available for this open discussion. Somebody has to feel safe to be able to open up and talk about it. But more important for the young girls is to give them sex education so that they are able to delay the age of first sexual contact. Because you realize when you are talking about 10, 15, these are very young girls and they are already engaging in sex. So I think the idea is to give them information, empower them enough to be able to delay the sexual activities to a later stage in life, when they are able to probably carry on with pregnancies. Okay? And then the other thing is, of course, as he said, providing contraception. Because you realize many women, if only they had used a contraceptive, they probably would not be in that situation. As he said, 70% of the ones that they looked at were not on any form of contraception. Okay? So we need to make information on contraception available, increase its access, and then that will really go a long way in terms of reducing the number of unwanted pregnancies.
But this is what becomes the tricky part, because you have the reports today in The Nation talking about mothers who are getting their children, their teenagers, on contraception. In fact, they dupe them into going to clinics, they're injected or whatever is put into them, they're told this is to make sure you don't get this and this cancer, but it's contraception. So because they are aware their children are sexually active, they are more afraid clearly of pregnancy than any other disease that would, you know, HIV, you name it. So how do you balance that sex education on one hand and contraception, but look at to what extent we are seeing it? I'll start with you, Dr. Ari.
Yeah, I mean, the point about parents taking their children for contraceptives, I mean, it has also emerged in one of the studies we did, where providers tell us that, I mean, parents bring their children and tell them to insert this and do this, and that this is going to prevent something, which is not exactly what it is. Yeah. So it's a major issue, and I think what I see here is an opportunity, in the sense that parents are interested you know, in ensuring that their children live, that the children don't die from unsafe abortion, that they finish school.
But they'll die from HIV. Or
Well,
they'll die from something else.
So I think that it goes back to the point which is making, that we need some comprehensive sexuality education. And this is where the key lies. That children need to be, our kids need to be, they need to be told about pregnancy prevention, they need to be told about HIV prevention, they need to be told about how to live their lives and enjoy their sexuality without putting themselves at risk. And I think that's where the secret lies.
And you'd say what?
Yeah, I think that is really the point, because when a parent has to take a child for contraception, they are really desperate. So and they are saying this problem probably has gone beyond them. It is a society problem, because these children are exposed to information from the media, from their peers, from places they socialize, and this is what is driving them towards early sexual activity. But
are you saying the parents are helpless, or are they absconding duty? Because there are those who look at it as absconding of duty, because they'll sit back and that's an easy way out to get this child on contraceptive, so nobody will ever know whatever is happening. But you're aware of how bad things are. So are we letting the parents off a little bit too easy on that?
No, I think that's what we are really saying, that the parents have a role to play. I said by saying at the family level, there needs to be a lot of support for people to have certain values, to delay sexual activity. So there's information that needs to be provided at the family level. But as I'm saying, it goes beyond the family to the community level, where these kids go to, where they socialize. Okay, the churches have a role to play. Okay. And the media also has a role to play, so that we are giving information that empowers the young person to delay sexual activity. Okay? And I think there's been an attempt, but we need to do more, because these figures tells us that what we are doing is not working. So we need to do more.
Yeah, because what's worrying is that there are more women dying in the process of procuring these unsafe abortions than we are losing to cervical cancer. So also these unscrupulous businessmen and women that are in operation, there needs to be a cracking of the whip in terms of the law, it doesn't there?
I think I don't know why we bring in the comparison, because I think cervical cancer is a serious condition. It needs a lot of attention.
In terms of the numbers, how many people are dying? You have cervical cancer, the numbers are not as high as the women dying in the process.
I think that is probably debatable, it's not for this forum. But I think what we want to say is that there is a problem of unsafe abortion. We need to address it. And the figures is an estimate, but they form a reference for discussion. Okay? And so I think the issue of unskilled providers and women going to unsafe places, backstreet practices which are unlicensed for these services, is, as I said, an issue about how open we are and ready to deal with this problem as a society. Because as I said, once a woman has a pregnancy and she's not keen to continue with the pregnancy, the avenues for seeking assistance are limited. If you went to most of our health facilities, they do not have these special clinics to address these problems. I think at Kenyatta what we have a youth-friendly service clinic where teenagers are supposed to walk in and get information on reproductive health. If they have conceived, they should come in, and we take them through the counseling and support, so that the only option is not just terminating the pregnancy. Because what we are seeing here is that it looks like many women feel that once I have conceived, the only option for me is to terminate the pregnancy. Okay, women can be supported through the pregnancy, okay, through counseling, but it is the social support structures for that counseling which are lacking at the family level. Because once she comes and tells the parents, everybody is in shock, she might be clobbered, you know. And so if you go to church, where you go to people like, what have you done? You have sinned, you know. And if you go to hospital, most of our facilities, if you walked into them, teenagers do not have a point. Is she going to queue on the general line for patients to say I'm pregnant? And So what is your problem if you're pregnant?
Okay.
You get it?
Yeah.
So I think it is the setup of the service delivery system which does not cater for providing for these women who may have a pregnancy, but at some point they are not keen on continuing with it.
Do you get a sense that perhaps encouraging for conversations around these sexuality issues between the teenagers and the parents, truly parents bringing them up and engaging at that young level, would help see these numbers go down?
Yeah, I mean, that has a role in addressing this whole problem, but that is not just the only solution. We're also thinking about parents, the bulk of whom might not be educated. They might not even know where to start, you know, in terms of talking to their parents, talking to their children. There are rural parents who do not know the difference between one method of contraception and the other. So these are major issues, and I think the government has a role to play in terms of, like you say, community education, in terms of supporting the system that's already in place to provide young people, both in school, both out of school, some support system to enable them excel and enjoy a healthy sexual life. The other point which this study, our study revealed, which is quite key, is that there are also lots of repeat abortions. So which has a lot of implications in the sense that women walk into facilities, the first time they have an abortion, then they present again the second time, and there is very little in terms of counseling on pregnancy prevention the second time. And that shows us where the referral system has failed, that shows us where the counseling system has failed, and even when they present the first time, very few of them work out with a product, you know, so which shows that there are lots of problems here and there, and we just have to get our acts together to be able to address this problem holistically.
Yeah. So it is more of what would you describe? Is it a moral issue? What type of an issue would you tag this as? Because then let's talk about the quacks, that they've been called, the backstreet doctors who are conducting more of these procedures, and you have some of them being interns that are now selling their services at cheaper prices, saying, come, you have a problem, we'll fix that. What kind of a problem then does this become?
I think it all goes back to, again, the regulation of service provision. In this country, you know, we've had a major challenge in terms of reading out people who are unskilled providers from practice. We have people ranging from herbalists, okay, who the medical board does nothing about them. They are not under their attention. Then we have small little clinics distributed all over the country. All of them providing services here and there. Most of them are unlicensed, and they run these services. So I think with the devolution system, I think the key thing is to sort of look at these providers and make sure that they are properly licensed, okay, and where they are providing services, they're actually skilled providers, so that we don't have scenarios where we have students who are still in training offering services. That in itself is illegal. Yeah, and so it's just a matter of really implementing our laws. But of course, part of the challenge is the secrecy around abortion, where a woman has terminated pregnancy. They may not be keen to speak out and say where it was done. Again, you realize when you do like that, for those of us who are in the bigger facilities where the women are referred to after they have complications from the small facilities, our primary responsibility, first of all, is to bring them on board, reassure them, and offer the service so that they are safe, okay? Because if you try to dwell so much on who did this, then you'll deter them from coming, and then they'll start dying at the community level. So we welcome them to the facilities, we offer the service, but I think there is need to go into deeper details of trying to find out where are these facilities located and who are the providers here.
So for now, there is no such attempts in terms of just trying to track it back to where the original crime, if I may put it that way, happened.
Yeah, there are challenges to it, as I'm saying, because you do not want women to die at the community level, to fear coming to the formal health system for care. Yeah. Because if you tried, then what will happen is she knows what she did was wrong. Everybody knows it is wrong. Okay? So if she comes to confess, then we'll have a lot of cases. You can imagine 462 cases in court of people who are trying to terminate pregnancy.
Terminate pregnancy.
Yeah.
So some of what I also was reading was that some these young girls.
I think the other issue is, especially for our medical students who may probably be engaging in the practice, the idea is to strengthen the teaching on ethical practice at the school level, okay, so that people know, and many of them know, so that when you engage in it, you know it is illegal, it is a crime, and you can be arrested.
Yeah.
And it is costing lives.
But that's also the supply side of it. That's also the demand side of it, which is, you know, there are lots of women out there who need an abortion, and no matter how you
who want, not quite
who want an abortion, and no matter how you counsel them to say, they will ultimately go and get it. So that is also something that you need to. So I think that demand creates some kind of market for this, in the sense that there is no place where they can get it safely, you know, because of issues with the law, and they think they want an abortion. So we need to address that that paradox.
Then it becomes this very complex issue, because once you're looking at one side, then there is the other. I mean, yes, they'll train and have the ethical part working, but there's a demand still, and this is a person who's thinking, you know, I need to make this money. But also the internet, that you can, I was seeing that they're mixing some cancer drugs alongside ulcers, is it? Make a combination, a mixture that then terminates the pregnancy.
There are lots of cocktails out there that people can develop these days to induce an abortion and stuff like that, and many of them are, like you said, quite unsafe for our women, and I think we just need to think of a bold step, you know, in terms of addressing this whole issue. And like you said, it must require a multi-sectoral approach involving how we teach our students, involving work in the community, involving work in the school, you know, getting our providers to, you know, begin to debate these issues and think of a sustainable solution.
What about the whole debate, pro-life, pro-choice? Because that is where some countries have gone to and have decided, if we went that direction, first, where do you lie in that debate? And would we need to get to that to see a solution, or would that just make things worse?
I think it's not so much where somebody lies. I think the issue is what are the strategies we have in place to reduce the mobility associated with safe abortion. And so what we need to look at is which is the primary intervention. Okay, we have said the primary intervention one would be to empower these women with sex education. Okay, so that they are able to delay or avoid having sex altogether at an early age when they may not be ready to carry the pregnancy. Then the other one we have said is the issue of contraception. So are we dealing with those two adequately? Have we taught our girls enough? Have we, in the media, in the church, in the other religious groups, at the community level, given enough information with regard to sex education and delaying the age of first sexual experience? Have we established youth-friendly clinics all over the country giving this information and information on contraception, okay, and the risks that go with pregnancy, so that when we have done all this, then we can now look at the late stage, because really the issue of terminating the pregnancy should be the last thing that we are thinking about, because as I said, even in that there is room now for counseling for those who have conceived. Just after you have conceived, you realize I had unprotected sex and I may be pregnant, so what am I going to do? Is there enough room to counsel these people so that many of them do not go the cheap route of terminating the pregnancy, because really terminating the pregnancy is a cheap exit route, so that we build the moral values in these people And then we will only maybe be left with a small number, as you say, who now, after all that discussion, they still, and then now that will have to go through the legal process. Okay.
So for you, in terms of this whole debate, those interventions are sufficient, and there should not be room as a country to look at the pro-choice, pro-life?
No, I think that is not really what I'm saying. What I'm saying is we have several strategies.
And
the law as of now gives room for several interventions,
yes,
which as of now we have not adequately utilized
so up until
to try.
that point, yeah.
And of course, the issue of legalizing or the services of abortion is not for the medical provider. It is a society issue, it's a moral issue.
And you don't
and
think
the
there?
laws as they are now do not allow. I think where we are now, we need to put in place these other strategies, because at the end of the day, if you legalize now, what you'll end up with is 562 abortions in public facilities.
Okay.
Is that what we want?
All right.
No.
Your thoughts on the same?
Well, in this whole debate, I think I'm just pro women. You know, it's not a question of pro-life or pro-choice. You know, our women are dying. We need to do something about it, and that is where we start. And that we can extend that debate and think about its ramifications. Maybe we don't have the time now, but I also tell you, borrowing from the point is made, which is where are we in terms of sexuality education? Countries that have very robust sexuality education also produce very low rates of unintended pregnancy. You know, Netherlands is just a clear case of that. They have one of the lowest globally, and this is because sexuality education starts very, very early in life. You know, and that is just one way to deal with that. Legalizing abortion does not stop unsafe abortion, because there are moral issues, there is stigma, there is death whole secrecy around it, so people will still look for alternative ways to deal with it. But what it does actually is that it reduces the complications that you see as they present in the facility. You know, there are so many things that we can do to deal with this. When we say 70% of the women who
are not on contraceptives,
what have we done? If we can reduce that to just 30%, right? That means we
there's a lot.
Exactly, that can be done.
And it's multi-pronged approach.
Yeah.
Doctor, talk to us about the dangers of going to this back street, so that for a parent watching, for a young girl seated watching and considering, what dangers one exposes themselves going through these processes.
Okay, when you look at safe abortion, basically, one, you may be having a provider who is not skilled. So, in the pregnancy is in the womb, which is hidden inside your body. So, anything you're going to do by somebody who is not skilled is putting your life at risk. And that's why many complications arise and lives are lost. But probably looking at it in terms of methods used and in an unsafe environment, because if you're going to terminate a pregnancy, then you need a very sterile environment to reduce the risk of infection. The equipment you're using has to be safe equipment for terminating pregnancy, because we know, depending on what you're using, you are likely to cause more harm than good. So, looking at maybe people who take herbal concoctions, these herbal concoctions are toxic to the body, and some women have ended up with kidney problems, they're in coma, and some die. Some women take overdoses of drugs they've been given by this provider, so they just even buy over the counter and swallow, also putting their lives at risk. It's like actually committing suicide, okay? But they are desperate. Then there are those who will use sharp instruments which can injure the womb, even injure your intestines, and we see them in the hospitals. When they come, they have complicated, okay? Some in that environment may not know the risks of terminating the pregnancy itself, including bleeding. So you find a woman bleeding in a small facility where there is no capacity to resuscitate her, and they have died in these facilities. So there are so many complications which can arise from these unlicensed practices, and women have to be aware. And that's why I said the best alternative, which most of them at that particular time of psychological distress would not think of, is to come out in the open, okay, and have a discussion, even at the family level, at church level, at the facility level where they go, or even at school level. If you approach the teacher and told them, I have conceived, what do I do? So, or you go, if you come to our facilities, that's why I say, even at the facility, we need to be prepared for young girls coming to us and telling us, I have conceived, I was not planning for it, what do I do? So that we take them through counseling that can encourage them to probably take the safer route of carrying the pregnancy, which is much safer to carry a pregnancy to term and deliver than to go for a backstreet abortion.
Yeah.
Yes.
But as you've been saying, it has to be all hands on deck, because someone will listen to you say, carry it, go talk at the family level or at the church level. But there are those who have tried, and the backlash they receive,
Yes.
they are told, you cannot come to church, you sinner, you know,
Yes.
you're a bad example.
Yeah.
Or at home now, you don't go out with everybody else. So when they think of all of those potential repercussions, then they choose, you know what, the easy way or the way to get through this. So it has to be everyone, you agree?
It has to be everyone. And at the point you've made about these complications, we are actually just finishing a study looking at the cost, the public health cost of managing these complications in the Kenyan public health system. And it's a huge, huge cost, you know, that the government is, in terms of providers' time. Imagine when an expert of this quality and status spends 8 hours on a typical complication of abortion, you know, and stuff like that. And it's a huge, huge amount of money that can actually be invested in other areas. So it's like government is involved, families are involved, the church is involved, friends are involved, schools are involved, and it requires that those linkages to be brought together for us to deliver successful interventions.
Okay, our time is up, so I'll let each of you have a parting short what it is you'd want to say finally in this debate. But I think we all agreed on that it's definitely multifaceted, all hands on deck. We have now healthcare devolved, so perhaps we need to hear the counties come out more and be more outspoken on this particular issue. But your closing thoughts, sir.
Yeah, I think it's a serious issue that we need all to come together and have a sober discussion, and then develop strategies for intervention, strategies which are acceptable to all, and then in the long term I think we'll be able to address the issue, because they are really preventable cases. The deaths that occur from this unsafe abortion are preventable deaths. So there are things which can be addressed if only we came together and discussed and put in place the right measures.
Yeah, I mean, just re-echoing the point you made, this is a very big issue, and it requires multi-sectoral approach for it to be addressed, and we're looking forward to a time when we all come together to find those solutions to this problem.
So you're saying you're doing a study about just the cost of it all, in terms of
the public health system.
The public health system in fixing the mess that's happening from the back
that's the
streets.
point,
And already looking, the numbers not good.
Exactly, that's the point. I don't want to let the cat out of the bag here, but very soon we'll be launching that study, and it's a major, major loss and cost to the system.
All right. Well, thank you, gentlemen, for joining us. Dr. Wycliffe Musalia, who is a consultant gynecologist at the Kenyatta National Hospital. He's also a lecturer at the University of Nairobi. And Dr. Chima Izugbara, who's a senior research scientist here in Nairobi. We thank you for being with us. We look forward to that study as well when the time comes. And that is where we'll wrap your health segment this morning. Of course, just looking at the matter of abortion, and the Standard newspaper went big on the issue yesterday. Those dens of death pretty much, and the backstreet clinics we are seeing taking girls through these very dangerous processes as they seek to procure their abortions. Also, just hearing the stats that 70% of the women procuring these abortions had never, been with taken contraceptives. So there's a lot that has to be done across the board, and we'll definitely be following up on this story to see how it develops. And parents, a critical role they have to play, because also I report today reading that it is many of these mothers taking their teenage daughters to have contraceptives either inserted, injected, whatever the case. It appears to be that the outward appearance of something having been done is more scary and is what most people are out to prevent than really dealing with the problem as is. We thank you for joining us and all of your feedback. We'll wrap up now with Michael. I think you're with me on which camera? There we are. Okay, I shall turn.
And I shall also turn. Sorry, I'm not turning away from you. I'm just turning to talk to Sophia. Yes, great conversation you had there. And, of course, bringing in the moral fabric of our society right now and where we are really into question.
Yes, it is, in fact, worrying when you think about it. What we were saying earlier, that it's more concerning the exposing of a sin, quote unquote, than it is really to deal with the problem. Then something is amiss, and it's across
the board. And I think the closing comments from one of your guests is that the church is involved, parents are involved, everybody is involved, which I think is pretty much what Dr. James Mwangi was alluding to when he said that we've lost that community fabric that we had before, where a community would take care of certain issues. Because this one now we've become very individualistic, and that's why I so much care about what others think about me. But the society really has brought us to there. So interesting.
Yeah.
Yes,
yeah. And a great interview you had there with Dr. Mwangi.
Dr. Mwangi. Yeah, it's one of those interviews where it's person of interest, but it could very well do for a Monday on Inspiration to just see that he grew up in an environment like everybody else, but was resolute on what he wanted to do, and as a result, he is making a difference and a positive impact in this country and world over.
All right. Well, thank you so much for being with us today. It was a delight to have you on the morning show. Stay with us for those on KTN News, and if you're not, you better jump in there. We're going to have a news update for you in just a few minutes. Well, actually, we should be off. Yes, we're going to have it now. Join us tomorrow again. Have a lovely day.
Have a good day. God bless.